Well, Governor Ned Lamont with a big announcement today, giving an update on masks in schools. The governor recommending the statewide mask mandate for schools and child care settings should come to an end.
Yeah, that recommendation being to remove the mandate at the end of this month, February 28th. Well, tonight we're joined by Dr. Ulysses Wu from Hartford HealthCare. Doctor, as always, we thank you for joining us. I guess point blank first, do you think it's a good idea to remove mask mandates in schools right now?
So he's not saying right now. We're going to say in a couple weeks. So actually in a couple weeks at February 28th, March 1st, that's actually kind of the tail end of the respiratory season. And so it does make sense. Now, numbers are dropping at this point, but they still remain high. But we suspect by that point at the end of February, beginning of March, it would the numbers certainly would be better. And with the tail end of the respiratory season, it definitely does make a clinical sense at this time.
Yeah, and it's important to note that it's putting the power back in the hands of local school boards and local school districts. So your town or city might still implement a mask mandate moving forward. But what does this mean for kids who cannot get vaccinated? Because the timing of this is also coming when we might see some kind of movement on vaccinations for kids at least 5 and under, right?
Correct. And so, anybody, it's really difficult to say, but we would say if you have the ability to get vaccinated, there's very little reason to not get vaccinated. And so we certainly would want that to happen. But what we're hoping is that there is enough immunity that will be surrounding them, and with a decrease in the respiratory rate as well as the percent positivity, that the kids will certainly be safer around that time. That is the hope.
All right, so Dr. Wu, as Jen just mentioned, schools may decide to keep the mandate in place. It's the state mandate going away, but with that state mandate going away, cases declining statewide, people might see this as a good sign in the pandemic. I would guess you would tell people maybe not to let their guard down quite yet.
Well, I think that's a very good point, and they really shouldn't let their guard down. So what happens, unfortunately, with COVID is that it's going to be an out-of-sight, out-of-mind type mentality. And what do I mean by that? Well, a variant could still pop up in I guess, towards the end of the summer, because variants tend to pop up in an unvaccinated population where respiratory transmission may be increased. And that we saw that last year with Delta in the southern hemisphere, which is their winter time. And then we're worried about also an endemic phase where possibly the respiratory season, October, November, December of this year, it'll pop up again. And if you are not vaccinated or boosted, you could be left unprotected. So we don't want an out-of-sight, out-of-mind mentality. We want to make sure that we're protected headed into these seasons, whether it be a variant or whether it be next winter season.
Dr. Wu, what is it going to take for the pandemic to be declared an endemic?
Well, so we basically don't want the virus circulating at all parts of the world at all times. And so we look at something like influenza, where the northern hemisphere is affected at one time, and then influenza will affect the southern hemisphere at a different time, and it becomes endemic to those populations. So it only affects certain amount of populations. Right now, it's affecting everybody across the world at this point, and even across the United States. Even though Connecticut may be doing better, there are certainly other states that may not be doing as well. So that's kind of how we get out of the pandemic, when it's not circulating everywhere.
Okay, Dr. Wu, we always appreciate your expertise. Thanks for coming on the News at 5.
Thank you for having me.
Appreciate it.